if you imagine that you're right-handed and you broke your right wrist and in some of your fingers, okay? And now you have to write with that hand, but you got a cast on it, okay? That keeps your hand fixed. Maybe you can move your fingers enough so that you can try and do stuff, but you have no mobility at your wrist at all. Okay, that's what traditional laparoscopics is for us. It's instruments that can reach forward and they can move side to side and stuff like this, but they're fixed. Da Vinci is the idea of now I have something that can reach and turn and do like this, and that's what I have available to me, is that ability. A wristed motion is where it just sets this light years away from what we're used to under traditional laparoscopy. The reason why I love the Da Vinci system is a couple different things. One, we talked about the wristed instruments, okay? You want it to be easy on me, okay? You want me to be very relaxed. You want me to be very, man, this is easy. This is a breeze. You don't want my instruments to be the hindrance to why I can't do what I want to do, okay? All right, so reduced blood loss, fewer complications, shorter hospital stay, and this is something that we've been seeing a ton with the Da Vinci system, is it is routine. Maybe 90% of my patients that have hysterectomies go home the next day. The other thing that I didn't mention is the visualization, okay? The Da Vinci system is like, you remember what are the viewfinders? Remember the 3D viewfinders? Okay, now you could watch, and this is exactly, so everybody get that picture in your mind. Now, you could you could see Bert and Ernie on television, okay? Two-dimensional. So you're looking at Bert and Ernie on your television. Then you got, for Christmas, you got a viewfinder with a bunch of Bert and Ernie little discs that you put in. You slap it in there and you're like, man, it's like you can reach out and touch them. That's the difference between traditional laparoscopy and the Da Vinci system. It is a 3D system that allows me to be able to visualize and see things at much greater magnification. This is my viewfinder. So the surgeon, which is myself, I'll sit at this viewfinder. This is the robot that holds on to the instruments. You don't get tired. Robot don't get tired. Normally what we do for our Da Vincis is you have 1, 2, 3, 4 incisions, sometimes 5, depending on how much more dexterity that you need, incisions. Like I said, most of them are probably about that big, maybe about a dime size, from side to side. Miami Valley Hospital is the leading gynecologic robotics system in the state of Ohio. We do more gynecologic robotic surgeries than any other place in the state of Ohio. With the Da Vinci system, you can save ovaries. You don't have to. You don't have to. Whereas in the past, you might have been like, oh, I got into a lot of bleeding because I was trying to do this and that and the other. You have precision. I want you to be very comfortable with the decision that we make. Not the decision that I make or that I'm trying to impose on you, but the decision that we make together as a patient and a physician to say, okay, this is what I recommend. Here are all the different options that you can go through. What do you want to do? And leave it in the patient's hands. Because I feel like that if I can do that, in the long run, you're not going to be frustrated or upset if you don't get the response that you want, or if you have more pain issues afterwards, because you've made an informed decision.